Hello everyone, welcome to Bone Doctor. In this series, I am discussing about osteoporosis. In my previous videos, I have talked about what is osteoporosis, what are its symptoms, and what are its causes. In this video, I am going to discuss about the most important topic of how we diagnose osteoporosis. Before the gold standard test of bone mineral density or BMD test using DEXA scan was discovered, osteoporosis was usually diagnosed by X-ray. In X-rays, osteoporotic bone looks very thinned out cortex, weak, and the overall density of the bone, when we compare it with the normal bone, looks somewhat lacking in calcium and density. This was how osteoporosis was diagnosed before BMD tests were discovered. After the bone mineral density tests using DEXA scan was discovered, this is one of the gold standard tests for diagnosis of osteoporosis. Now let us understand what is a DEXA scan. DEXA stands for Dual Energy X-ray Absorptiometry. In simple words, it is a X-ray examination, a little bit complicated than an X-ray examination, which helps us to determine the density of the bone of the patient. What are the sites where we do a DEXA scan? It is mostly commonly performed in the vertebral column or the spine because it is the most commonly affected bone due to osteoporosis. It is done in the hip joints, both hips, and rarely it is done in the wrist joint. So assessing the bone density of these three areas, we can understand whether the patient is suffering from osteoporosis or not. We grade osteoporosis on 4 grades. We first do a DEXA scan of a normal healthy individuals of 25 years of age, males and females, of a particular country or of a particular ethnicity. We take that data into account and that we set as normal mean. Now any deviation from that mean means if the density is lower than that mean, then we grade it as osteoporosis. If it is from +1 to -1 standard deviation of the normal, then we label it as normal. That is, the patient is not suffering from any osteoporosis. If the density is bone mineral density, BMD, in DEXA scan appears from -1 standard deviation to -2.5 standard deviation, that means the person is suffering from osteopenia. That is grade 1. And if the person's bone mineral density is less than -2.5 standard deviation of that normal population, then the person is suffering from osteoporosis. If there is an associated fracture, then it is further bad and we label it as osteoporosis with fracture. So who are the patients whom we should advise or who should regularly undergo a bone mineral density scan, a bone mineral density test through a DEXA scan? If a person is more than 60 years of age and has symptoms of osteoporosis, that is, the patient has encountered a fracture, patient experiencing bone pain, etc. Perimenopausal women, that is, women around 45 to 50 years of age, that is, who are nearing menopause or have just had their menopause. During or after menopause, the bone mineral density of a woman rapidly drops. Thus, checking the BMD helps us to understand what is the severity of the osteoporosis of that person. If it is excess, then she needs treatment. So these are the ways by which we diagnose osteoporosis. There are some other methods as well. Doing a plain X-ray. Ultrasound BMD or ultrasound bone mineral density is a very commonly performed test in communities when we do camps to test bone mineral density in many persons or a population. Then ultrasound BMD is a very cost-effective tool to screen osteoporosis in a population. There is quantitative CT examination, CT bone marrow density test by which we can also determine the bone mineral density of the bone of the particular person. So this is how we diagnose osteoporosis. So if you have liked the video, please give a like and do share it. And if you like my channel, please subscribe to it. In my next video, I'll be discussing the last part, the most important part, that is treatment of osteoporosis. So bye bye for now. Take care.